What is a self-collect cervical screen and how do I get one? Good day, I'm Dr. Tia, and today I thought I'd talk about the self-collect cervical screening test. In Australia, a cervical screening test starts from the age of 25 and continues every 5 years until the age of 74. This all depends on the age of sexual debut, and if sexual debut was attained really early, often screening has to start early as well. A cervical screening test is just that, a screening test, which means you have no symptoms. You just happen to have a cervix, and the question is it a happy cervix or have cells started changing on the pathway to cancer? The test therefore assesses for the presence of HPV, the subtypes that are present, if any are, and if needed, performs a review of the cells of the cervix to see if they're changing on the pathway to cancer as a result of that HPV presence. A screening test means there are no symptoms, no abnormal vaginal discharge, no bleeding after intercourse, no bleeding in the middle of the cycle. Those are some of the screening questions your doctor will ask before they give you a self-collect swab. If you've answered no to all of those questions and you have absolutely no symptoms, you can collect your own cervical screening test. We can use a cervical screening test to investigate those symptoms, but it cannot be a self-collect swab. The swab looks like this or similar to this. You would collect this either behind the curtain or in the bathroom. You would open the jar, and this one has a red line, as you can see. At that red line, there's a ridge. There's a ridge at that line. So you would hold the swab at that red line and ridge, insert it into the vagina, and swirl around and count to about 30. That is long enough for this to collect all the moisture, which you would then insert into the swab, and ta-da! That is your swab collected. You will have some paperwork to sign to send this to the lab, and the results can take 3 to 4 weeks, with often a letter in the mail if everything is fine saying see you in 5 years. If there are any abnormalities picked up on this, such as you having HPV, then we would need to collect the old school pap smear, because the next question is, how long has that HPV been there, and have the cells started changing on the pathway to cancer as a result of that HPV? But I hope that clears things up, and don't forget to get your pap smears done. Till next time.